APS professional Anthony Garcia arrives at the home of Rachel Carr to interview Rachel and assess for risk following a report of self-neglect and financial exploitation.
At the tone, please record.
Who is it?
Hi there. I'm Anthony Garcia. I'm with Adult Protective Services. I was hoping to speak with Rachel Carr. Is Rachel home?
What? What do you want?
I'm a caseworker for Adult Protective Services. I was looking for Rachel Carr.
That's me. I'm in a wheelchair. I can't get to the door. You said you're a caseworker?
That's correct.
Okay. Door's open. Just let yourself in, I guess.
Is there anyone in the home with you or any animals?
No, I don't have any animals. Kids out with the car running errands of some sort.
I don't know if you heard me out there. I'm Anthony Garcia with Adult Protective Services. Feel free to call me Tony or Mr. Garcia if you prefer. I just wanted to come in and check in and see how you're doing. But before we get too far along, I just want to make sure that you're comfortable with me being in the house here with you today. Do you feel safe speaking with me?
I suppose I am. You're in here already, right?
That's true. Do I have your permission to sit here?
Fine.
You mentioned you had a child out with your car. What's their name?
Riley's 32, hardly a child.
I have a colleague named Riley, so that's gonna be easy to remember.
You know what? I don't have time for small talk. Get to the point. Why are you here?
We received a report of concern and some possible care needs you have in the home. I have your name down as Rachel Carr. Is it okay to call you Rachel during our conversation today, or do you prefer something else?
Rachel's fine. What do you mean, a report of concern? Who called you?
Unfortunately, I'm unable to share who contacted our offices, but I understand from the information I was given that you had a stroke recently. Is that correct?
Someone calls you about me, and you're unable to share who that someone was? That's ridiculous. It's no one's business but my own. I should be able to know who's talking about me.
That makes sense, and I appreciate your desire to know, but there are confidentiality policies in place when reports like these are made. I'd like to start with the information provided to me that you've recently had a stroke.
Had a few, actually. First one was more than 2 years now. And the last one was just this past year. This most recent one left me quite weak on my right side. I have almost no use of my right hand.
I'm sorry to hear that.
It's been a real struggle. I can't do the things I used to be able to do. Like, I used to have a very tidy house, and as you can see, not anymore. Sometimes it's hard just getting myself up out of this chair without help.
Who helps you in the house?
Just have Riley now. I don't know who told you about me, since you're forbidden to tell me, but I was in a nursing home up until a few weeks ago and sucked up what little savings I had. Anyway, I couldn't afford to stay there, so they released me back here. And truth told, I prefer it. My health insurance won't pay for physical therapy because they don't think I'm gonna get better. Thankfully, Riley was able to come stay with me for a few weeks until I can learn to do things on my own. Been a hard adjustment for everybody.
What kind of adjustments?
Well, before the first stroke, I was a hairstylist. I worked in a salon, just not too far from here. And with some steady regulars and tips, I was able to make the rent on this space rent here for this place. Things were tight, but I never missed a payment. Now unable to do hardly anything for myself. Riley took a temporary leave of absence from work. It was an unpaid leave, and with a family of their own to support, they had no choice but to go back to work. There's been little relief to their stress, and Riley's even threatened to put me back at the nursing home.
When you say threatened, what do you mean?
Nothing serious. Riley just worries too much about me being by myself and is scared because I can't do a lot on my own. What really sucks is they live over an hour away, almost an hour, and so can only come like a few times a week to help me with the stuff I really need help with.
Got it. Thanks for clarifying that. To help me understand your situation better, let's talk about the difference between what you are doing for yourself and what, like you said, you really need help with. Let's start with what you're able to do with your hands.
Okay, well, I can't use my right hand. I had some exercises they taught me how to do at the hospital. I try to keep up with them, but I don't know if they're even helping. I feel good about what I've been able to do with my left hand. I can get around in the chair, and I can use phone.
What about grooming?
I'm able to brush my teeth and my hair. I was able to put lipstick on this morning. I can eat, but it's a lot of work. With the practice and patience, I can use a spoon, I can use a fork. Can't cut food with a knife. Yeah, eating soup with a spoon wasn't much of a success. So I just use the bowl and pick it up and drink it.
How about standing and when you have to get out of your wheelchair?
I can pull myself up if there's something to hold on to. Man, it'd be helpful to have one of those grab bar things. That'd be good.
So, you're able to do a lot of stuff with your left hand. That's great. You also mentioned some challenges. What else are you having difficulty with?
I need help. I have trouble getting from the bed to the chair. It's so much easier getting into the recliner. So going back and forth from there makes it easier. So I just sleep there most of the time.
What else?
Bathing, cooking, wrestling with those damn pill bottles. So many. And driving, obviously. Not to be crude, but difficulty using the restroom.
Thank you for sharing, Rachel. So how do you manage the stuff that is more difficult, like bathing or using the restroom?
I'm not going back to the nursing home. And I don't want anyone else in this house with me. So I make do until Riley gets here.
It seems like the strokes have changed your life in ways you could never have anticipated. How have they impacted your safety in the home?
I feel safe. I mean, I would like to reactivate my cell phone. I only have the landline, and it's not easy to get to from the chair. I had to cancel both my cell and my internet service when I lost my job. And I can only afford the landline.
That makes sense. I might know of a low-cost cell phone service that you could check out. Could I ask you more about what you are able to do for yourself and what you need help with?
Why do you need to ask me these things? Why do you need to know?
Good questions. One of my roles is to link the people I work with to resources that can possibly help them. By getting to know you, what you're doing for yourself, and what needs you have, I hope to be able to connect you with resources or services that will help you stay as independent as possible.
Okay. As long as you don't treat me like a child. Oh, like those people at the nursing home they did. I get so frustrated. I know I talk slower, but I can understand what people say. I can still hear. and I can make my own decisions. I have never been shy about telling others what I need.
I love that. Now, I've noticed some papers over there about in-home caregiving. Where did those come from?
Oh, those people at the nursing home wouldn't let me go home unless I had caregiving in place. So I just picked the first company they set me up with. Had them a week, kicked them out. No one is gonna come in my home, intruding my space, and then expect to be paid to watch videos on their cell phone. They could be cleaning or doing something helpful. Besides, I only bring in about $2,000 a month, and that has to pay the rent for this ramshackle.
You mentioned Riley was out with your car. Do you know when they will be back?
I don't know, maybe an hour. Riley's car broke down, so they're using my car, which it's fine. I can't use it.
If Riley comes in while I am still here, how would you like me to identify myself?
If Riley comes back, you can say you're a social worker. It's fine.
Thank you. If Riley comes back while I'm here, and at any time you're not comfortable or you don't feel safe with me here, please say you're tired or something to that effect, and I'll know to leave.
I understand.
Also, is it okay for me to call and leave messages at this number?
It's okay. Call, leave messages.
Great. That will be helpful. Rachel, I want to go back to something. You mentioned you do what you can until Riley comes by. Can you tell me more about the things you can't do without Riley or some other help?
It's embarrassing.
I understand that we're talking about things that are very personal. I appreciate your honesty and I want you to feel comfortable sharing.
Okay, well, you see the damn adult diapers over there? The worst having to wear those. Getting to the bathroom in this chair is only half of it. Then I have to get from the chair to the toilet. I call it the maneuver. It takes so much time and effort that it ends up in a mess. So use the diapers to avoid accidents. Damn, this is so embarrassing.
That's understandable. I also recognize that these aren't things you normally share with folks.
Yeah?
But in my work, these are things I talk about with people all the time.
Well, last week I fell down doing the maneuver. Thankfully, Riley was home and was able to get me back into my chair. I was only on the floor a few minutes. I'm pretty scared of that happening again because no kid should have to do this stuff for their parent.
I'm glad you told me about your fall. Have you started that conversation with your doctor?
No, I told you, I was only on the floor a few minutes. Riley was home. It's not necessary.
Okay. Sometimes when people fall, there can be internal bleeding that we're not aware of right away, especially if you're on blood thinners or other medication. A follow-up visit with your doctor might really be important.
It didn't hit my head. I just banged my knee. It was tender for a day or two.
I'm sorry about your knee. I'm glad you didn't hit your head. When's your next visit with your doctor?
I don't have anything scheduled for a while.
Before I leave, we can call and see if we can get you another appointment. They might at least be able to have a nurse do some triage over the phone.
No, I don't think it's necessary. I told you, I was on the floor a few minutes. I just bumped my knee. It was sore a day.
Okay, Rachel. I am still going to suggest it. Now, let me ask, how do you manage your incontinence briefs when Riley's not here to help you?
It's difficult with one hand, but I make do until Riley comes by.
Have you had any issues with your skin or other medical concerns from wearing the briefs for too long?
do my best not to have a BM when I'm going to be here by myself for a long time.
I can imagine that can be uncomfortable and stressful. Thanks again for sharing all of this with me. I know it can be difficult talking about these very private things. I heard you say you are able to feed yourself. What sorts of things are you eating?
Pre-made things, soups, sandwiches, things easy to only use one hand with. But hey, you know what? I was able to put bread in the toaster today. I dropped one slice, putting butter on them, but it's stuff like that. Sometimes I just don't eat. It's too much effort. Too bad, because the medicine, most of it says take with food.
Okay. It sounds like you're eating, maybe just not always what you'd like or as often as you should. Does that sound about right? You mentioned your medications. What kind of medications are you taking?
They're all right there. I can't open the lids, so Riley suggested leaving them off. It would be nice to have them a little more organized.
To make sure I understand it correctly, are you taking your medications as prescribed?
Well, with the struggle with the lids and not always eating, I miss, a few doses here and there. I feel okay. I think it's okay, don't you?
You might feel okay, but based on the prescriptions you have and what the medications are prescribed to treat, it's best to take the correct doses. That might be a great thing to discuss with your doctor also. Other than Riley, is there anyone else who can come and offer you support at home?
To be honest, I haven't reached out to anybody since I got back. There are 2 neighbors who know about it, and they offered to check in on me, but I don't want to be a burden, and I don't want them to pity me. I know I can't do as much as I used to, but I don't want anyone treating me like I'm useless.
It sounds like you have others around who might be willing to help.
Yeah, I know they care. I don't want them seeing me like this or this place like this. Before my last stroke, we had a book club. We met once every few weeks. Anyway, I quit.
What are some reasons you quit?
Well, I certainly can't host it here. It's really hard to read a paperback with one hand. My vision is getting worse. I can't even see normal print now. Riley suggested one of those electronic readers, but they're so expensive.
What would help you reconnect with your friends and maybe get back involved in that book club again?
Library card or access to audio books or something? That might help.
Would you like me to look into that for you?
Could you? That would be wonderful. I really enjoy reading or listening, whichever.
Rachel, I'm getting a better picture of how things have changed for you since your last stroke. You're no longer doing hair, you're not driving, and you don't have as much interaction with your neighbors. Am I understanding things correctly?
Nothing you said is wrong, but I don't like hearing it like that.
How have these changes impacted your mood or how you feel today?
I don't know. I don't really think about it. I haven't noticed anything. I mean, I spend most of my time trying to do the exercises to strengthen my right side. And when Riley comes, talk about my grandkids and get to watch videos of them, keep up with what they're doing.
Got it. There can be a lot of feelings that people have when there's so much change, especially when it happens so quickly. Depression, sadness, hopelessness, and even thoughts of suicide. I need to make sure
I mean, how can somebody not have sad feelings when there's so many life changes? But I don't want to die. I need to see my grandkids grow up and graduate get married.
I can see how important they are to you. I need to still ask. Have you had thoughts of suicide?
No, no thoughts like that. And I told you, I'm not useless.
You have told me that. I can add that I've also seen how these types of changes impact people's sleep and even their motivation. It sounds to me like you're motivated to keep getting stronger.
I certainly am trying.
That's great. Earlier, you mentioned your phone is inconvenient and you thought about reactivating your cell phone. That would help. In addition to that, have you ever heard of a personal emergency response device?
You mean like those things you wear and you, in case you fall, you can press a button, call emergency? Oh, yeah. I've seen them on ads on TV for old people. Never thought I would need one. Is it expensive?
There may be programs that can help with the cost. If you like, I can look into that for you in the cell phone service. Then maybe Riley could send you videos of your grandkids and you can watch them anytime.
Oh, I would like that very much. My grandkids are the cutest.
I bet they are. Okay, I'll check it out and see what's available. When I was outside, I noticed those steps leading up to the front door.
Yes, and the security screen door opens out and it makes the porch very, very narrow. It's a lot of trouble getting in and out with this wheelchair. I can't do it on my own.
There might be some programs or services that help with home repairs like that, especially when somebody's gone through an injury or illness. Shall I add that to the list of things to check on for you?
I'm not going to turn it down if you find something.
Rachel, another concern that we have is regarding your money and making sure that it's being used for you. Can we talk about that for a minute?
What do you know about my money? I don't have any money to spend.
How do you handle your bills?
Oh, I haven't paid any attention to them for a long time. Riley took that all over for me when I went in the nursing home, and honestly, I just haven't had the energy to take it back since I've been back here, so.
Do you have any of your statements handy?
I think they're in that pile over by you.
Would you mind if we looked for a statement together?
Sure. They're over there. It's right there. By you. Can you hand me my magnifying glass and letter opener? Yeah. Yeah. Okay. This is the stuff. Okay. Oh, this stuff is so frustrating.
See these transactions here for video games? Did you authorize those?
You're not trying to accuse Riley of something.
No, I'm not making any accusations. I'm asking to see what you have spent yourself and if someone else has access to your accounts.
You know, you're barking up the wrong tree if you think Riley is up to anything suspicious.
I understand what you're saying. If you haven't looked at your statements in a while, I would have recommended that you review them anyway. Would you be willing to organize the most recent bank and credit card statements dating back to when you entered the nursing home and Riley took over your bills?
I need some time.
That's fine. Because Riley's been taking care of your bills like you've said, I'd like to connect with them so I can ask about how they've been managing your finances and if they're aware of these transactions.
Yeah, go right ahead. Riley's got nothing to hide. I'll talk to Riley also about it.
Thanks, Rachel. You have my business card and call me after you talk with Riley and I'll follow up as well. I'd like to contact the bank as well to get a better picture of your financial history.
It sounds like you think someone's trying to steal my money.
That's part of why I came today. Being able to talk with you, Riley, and the bank helps me assess what, if anything, might be going on.
Sounds like a lot of work, but okay.
I appreciate that, Rachel. Okay, I only have a few other questions about your finances and medical care. But before I continue, I want to review with you my action items so far and the list of things I intend to follow up. Once I have some resources that I think will be helpful, I'd like to come back and share them with you, if that's okay.
That sounds okay, but I'm not agreeing to anything yet.
All of the services we're talking about are voluntary. I'm going to start with looking into the library services near you and how to get you access to books and audiobooks. If we can get you a low-cost cell phone with a data plan for internet service, it's likely the library has an app that will allow you to check out books and listen to audiobooks online. I'm also going to check with the personal emergency response system. And let's see if we can get some work done on that front door.
You can do all that.
I will certainly look into all of this, but I can't promise what will be available or not. It's good to know our options, and there are often more resources available than people realize. Next on my list are some of the things that you can put in your bathroom that can help you with the maneuver. Basically, these are safety handles or other grab thingies, I think you call them, and they're designed to help you move from your wheelchair to the toilet and back.
Oh, they have things like that.
There are several different kinds, of course, at different price ranges.
Yeah, be mindful of the price.
Of course. Now, you are quite clear that you do not want to go back to a nursing home. I get that. But I also heard that you can't afford a private caregiver and that you really don't want someone intruding in your home.
You heard that right. Look, I know I can't do a lot. It's not perfect, but I feel like I'm doing okay. Aren't I?
It is clear, Rachel, that you want to stay as independent as you can. When we talked about the book club, you said you stopped going because you didn't want people to see how much you were struggling. That makes sense. But maybe we can agree that you have challenges beyond the help that Riley can provide and you're embarrassed to have to rely so much on Riley for help. Has anyone ever talked to you about in-home personal care services?
I don't recall ever hearing about that.
There are some programs that have caregiving services that we can explore. There are also community adult day facilities that you could attend for a part of the day and transportation services to get you there and back safely. It would get you out of the house and you could connect with other people. You wouldn't have to be alone so much.
It sounds expensive.
I think you'd be surprised to discover how many of these services are no or low cost. Some may even be covered by your health insurance. It would be my pleasure to check into some of these for you as well. Would you be open to hearing about it if I did the legwork?
I mean, be foolish not to consider it. Since Riley isn't here anymore, any help would be better than nothing. You don't suppose you could get someone to help me clean up this mess?
I'll add house cleaning assistance to my list.
How do you know about all these things?
It's important for me to know what's out there to help people be safer and healthier. Speaking of types of support for you, I realize you asked me to call you Rachel, but can you tell me what pronouns you use?
She? Why do you ask?
I ask for a few reasons, but mainly, I never want to make assumptions. It also helps when researching for some of these resources. It's important to know certain demographics and address you in the referrals as you identify.
I appreciate that. Is that all you need?
Yep, for now. I'm going to start working on finding out what resources are available right away. I'll call you in the next couple of days to share what I've found. When I call, we can set up a convenient time for me to come back to see you.
That seems fast. You can do all that? That seems like a lot on you. I don't want to be a burden.
You're not a burden at all. Allowing me to help you is what I hope for. Some people I meet with won't even speak to me.
Well, I do feel a bit better about all these possibilities.
Thank you for seeing me and letting me have this honest conversation about your needs. I'll see you next week.
I'm not agreeing to anything yet.
It would be my pleasure to check into some of these for you as well.